The World Bank and the WHO estimate that globally 400 million people do not have access to basic healthcare services. And in places where there is access, health services is unevenly distributed as gaps remains between the rich and the poor, men and women, as well as urban and rural populations. This, stakeholders in the healthcare sector in Nigeria say must change. But how? This forum, at the instance of the Federal Ministry of Health, Nigeria, in collaboration with a leading German pharmaceutical company, is advocating a robust and vibrant participation of the private sector in achieving universal health coverage in Nigeria to reduce out-of-pocket expenditure, among others.
Our objective is to enroll the entire country, all residents in Nigeria. It will be extremely cost-effective. It will be cheaper for government, it will be cheaper for the individual enrollees. So when we incentivize the private sector, they could do that. Apart from financial coverage, and I think products become available, especially drugs. There's a coverage, both rural and urban centers.
Experts at the forum say political commitment backed with adequate financing will change the trend.
Every country in the world, and in particular every government in Africa, is struggling with how to achieve universal health coverage for its people, how to make quality medical care available in an affordable and equitable way to all its people. Different countries have made different types of progress. We've discussed today that the Nigerian government is now putting a lot of emphasis on universal health coverage, and we expect a lot of progress in this area.
It's something that we've actually been yearning for, because achieving universal health coverage cannot be achievable without the involvement of the private sector. And one of the things that this forum is actually bringing to fore is the roles that the private sector will play in achieving universal health coverage. How do they intervene? How do they support the public sector to be able to achieve universal health coverage? Without the private sector, universal health coverage is still far off from us.
Over time, the universal health coverage target has been described as a big and complex task, but stakeholders in the healthcare sector are optimistic that it can be achieved in Nigeria through accountability, commitment, and transparency. In Abuja, Isaac Nkuma, NTA News.